The term CARD stands for chimeric antigen receptor T cells. Every person has immune cells, and among those the T cells are very active at destroying not only malignant cells but cells that have been infected by viruses. So the T cells are kind of the tool which is used to target leukemic cells, and the T cells have surface structures, and one of them is called CD3, for example. But they don't necessarily detect the leukemic cells. Now in ALL we have the advantage that there is a surface molecule, a surface structure called CD19, several others exist as well, that are present on very few normal cells. So what the CAR T cell therapy does is that the patient's T cells, the patient's immune cells, are taken out of the body. They are then genetically changed to be able to recognize the CD19 on the leukemic cells. And there are a number of other changes which make the T cells more effective so that they are stimulated, that they can grow, they can amplify. And then after this process of changing the T cells is completed, they are reinfused into the patient. So typically it's the patient's own immune cells that are genetically changed to target the patient's leukemia. So what then happens is after the infusion, the T cells recognize the ALL cells, and they not only destroy them, but they grow. So to take the analogy that I had earlier, the goal is to outnumber the bad guys, which works very well, but of course may create some problems because if you suddenly have a huge 100,000-fold expansion of T cells, they produce all kinds of hormone-like factors. They destroy the cells. So it is something where complications ensue. But at the same time, this large number is able to very effectively eradicate all of the leukemic cells in a significant proportion of patients. And they may persist so that if the leukemia is gone, some of these CAR T cells, not all of them, but some of them persist in the body at a very low level, and if the leukemia then starts to come back, they're there to attack it again. It's a very complex procedure. So from the time that the patient's peripheral T cells are taken, it's like giving blood. Sit down, there's a machine that extracts the T cells, and the time until it is reinfused will take anywhere between 3 and 5 weeks. During this period, the patient may need 2 types of treatment. One is to control the leukemia until the drug, the CAR T cells, can be reinfused. And the second is to make space in the bone marrow, and that is called a lymphodepleting therapy, which has been shown to be very important. So it's not really meant to attack the leukemia per se, although it is chemotherapy, but actually to enable the T cells to, lodge into the bone marrow, expand, and do their job. So I think the elegant part is that it really uses the patient's own immune cells, tweaks it, and increases its potency.